Dr. Singh, what is your process for placing dental implants?
Firstly, we always start off with an information session. We offer a complimentary consultation with any patient who is thinking of implants to see if they are in fact an appropriate solution. We give you the chance to ask any questions you have and provide any answers with regards to the implant process in general. There are many misconceptions of implants, and a lot of people think they're much more complicated, or the process is much more complicated than it actually is. And every office does it differently, so we like to go through and give you the information that you need to make that decision and tell you what the process is in our office. Essentially, in our office, that is a three-step process. We usually start by a thorough clinical examination and taking the necessary images that are necessary for planning that implant. Once we've decided on the treatment, along with you, the patient, we would decide what that treatment is. Once we have agreed on what the treatment is, we would go ahead with planning and executing that treatment. Placement of the implant into the appropriate site is the second step of that process. And it can be followed by the third step in an ideal situation, and that third step is placement of the restoration. So in the case of a single tooth, we're placing the artificial root and we're placing the artificial crown, and that's the whole process. The screening, the placement of the implant, and the placement of the crown, and that's it. And as I mentioned, in some cases, those steps 2 or 3 can be done together. Of course, after all of that, we always have long-term care and follow-up with the patient to make sure the area is being maintained properly and make sure you're keeping everything nice and healthy and doing everything to make sure that implant survives for a very, very long time and serves you well.